The liver is an important organ of our body that plays a central role in all its metabolic functions. On the occasion of World Liver Day, MediCircle is conducting an exclusive series with eminent gastroenterologists and hepatologists so that there is more awareness in people regarding liver and its diseases. Hi, this is Amrita Priya, and you are watching MediCircle. Today we have Dr. Vishwanath Gowda in our show. Dr. Vishwanath Gowda is a well-trained advanced laparoscopic GI, bariatric, and HPB surgeon. He is associated with Holy Family Hospital, Global Hospital, St. Elizabeth Hospital, Somaya Ayur Vihar, and Godrej Memorial Hospital, Mumbai. He is very passionate about clinical research and academic activities. He has several papers published, both in national and international journals, and has given presentations at various scientific forums worldwide. His research interests include treatment options for morbidly obese patients, treatment modalities for liver and pancreatic cancer, improving laparoscopic access for liver surgery, and providing minimal access gastrointestinal surgery for weaker sections of the society. Welcome, Dr. Vishwanath, to MediCircle.
Thank you, Amrita. Thank you for the warm welcome.
So, Dr. Vishwanath, to begin with, what symptoms would a person notice if he or she is suffering from liver diseases?
Yeah, most of the time, patient who is suffering from liver disease will have some amount of loss of appetite, abdominal pain, nausea, doesn't want to eat much. And as it gets worse or symptoms persist for longer duration, you will start having jaundice, high colored urine, means your urine will start turning yellow, and you will have abdominal distension. When the fluid starts getting collected in your abdomen, which we in medical terms called ascites, then you'll start having bulge in your belly. You'll start your abdomen becoming distension. Sometimes people may call it a beer belly, but it is always better to go and show your doctor to see if your liver is proper or not. Also, patients, who are the patients who would have liver problems? So anyone who is overweight, obese, or someone who is consuming alcohol on a regular basis, or had some liver problems in the past, those are the patients who are at higher risk of having liver problems. And also those patients or people who are on this Ayurvedic or homeopathic medication for a long time without knowing what does it contain. You know, sometimes they take some churn, some powder without knowing what it contains. Sometimes they also land up in liver problems. So be careful what you're taking. Yeah.
Okay. And what about liver tests? Like liver test, if someone is healthy too, and there are no symptoms as such. So does that person also require liver, some kind of test to ascertain that the liver is working fine?
Yes. Very, very important. I think everyone should do liver test at least once a year when you are doing your annual health checkups, or someone who is more than 40 years old. One blood test is more than enough. It's called a liver function test. It shows about your liver enzymes, your bilirubin, and also albumin level. Because these are the three things which will show in the liver. If your liver test is borderline or abnormal, then you can go for an ultrasound of the liver, which will show if the liver is if there's any edema, or if there's any swelling in the liver, or if there is any jaundice which is blocking your liver. So a blood test and a sonography is very important to check for your liver. I think you should do once a year at least. So anyone who is having diabetes, blood pressure, or overweight should keep a check on the liver.
Okay. And what about fatty liver? We hear about fatty liver quite often these days. So how is that treated?
Yes, fatty liver is very, very, very common nowadays. And it's good that people are becoming more aware and more concerned when they see the ultrasound showing fatty liver, and they come to see us to see what it is thing. So fatty liver is, there are 4 stages of fatty liver: stage 1, stage 2, stage 3, and stage 4. So from stage 1 to 3, it can be treated with medication, diet control, and weight loss. The moment it becomes stage 4, it's a problem, big problem. Because from stage 4 onwards, the only treatment of fatty liver becomes a liver transplant. So you have to change your liver. So whenever there is grade 1 fatty liver, don't ignore it. Go and see a liver doctor or ask your physician whom to go and see. And more important, most of the time, a fatty liver is related to your weight. So if you are overweight or obese, try to knock that weight off. Even if you lose 2 or 3 kilos of weight, your liver will become normal. So fatty liver, one thing is cut down your fast food habits, like all your fried food, cheese, fast foods should be avoided. Try as much as possible to have fruits, green vegetables, and inbuilt daily exercise of about 60 to 75 minutes per day. That is very, very important when you have a fatty liver. Don't take it lightly.
Okay. Dr. Vishwanath, you were talking about some healthy food for people suffering from liver ailments like fatty liver. Do you suggest any food supplements as such which people can take to keep their liver healthy?
Yeah, liver as an organ is a very unique organ. It has got the potential to regrow, means it can regenerate. Like how you cut your hair, then it again regrows back. Like that, God has given us the beautiful opportunity to help the liver to regrow. So, and what does it help? It helps in the liver to regrow by taking more proteinaceous food, more of carbohydrates, and less of fatty food. So, if you want to help your liver, you should try to have as much as fruits, green vegetables every day. Try to avoid oil, fats in your dietary habits, and no consumption of alcohol at all. So, if you do these 3 things, you are helping the liver to regrow. So that if there's some amount of fattiness in your liver, that fat will dissolve and liver tissue will regrow in its place. So in 24 hours, make sure your food plate is covered with some colorful items, like you have some red fruits, some green vegetables, those. So your food plate should look more colorful. So more colorful means you'll have more organics, more vegetables, and more fruits. That should be the ideal goal. And the other thing in liver is you can have as much as fish, chicken, eggs, because that is high in proteins. So anyone who is a non-vegetarian should try to have this component in the meal at least once a day.
Okay.
That's highly recommended for liver patients.
Okay. So Dr. Vishwanath, you are suggesting a natural food instead of any supplements, additional supplements to ensure good liver health, isn't it?
Yeah, because we straight away will not jump on supplements. If the patient is able to eat well, we just want to tweak the diet habits so they eat the right amount of food. And with that, we are able to have a goal where we can give him enough proteins and enough supplements for the liver. Only in case that the patient is not able to eat well, suppose he is having vomiting, nausea, or for some reasons not able to keep the food down, then only we advise them supplements which are good for the liver.
Okay. So thank you so much, Dr. Vishwanath, for sharing your insights on how to keep our liver healthy. I'm sure it is going to help our viewers to kind of adopt a good, healthy eating habit so that they do not face any ailment or they do not kind of experience fatty liver, which is very common these days.
Yeah. Whenever you have fatty liver, look at your weight. See what is your weight, ideal body weight. If try to bring your weight down for a fatty liver patient, and also see your doctor so that any problems which can arise in liver is taken care at the right stage instead of waiting for long and for the liver to get more deranged. In my opinion, yeah. Don't take fatty liver in a lighter way.
Okay. So thank you, Dr. Vishwanath, for sharing your insights. And thank you for being part of the MediCircle show on the liver awareness series.
Thank you so much, ma'am. Have a good day.
Thank you.